Good morning. Thank you all for joining. We will give it 2 more minutes for others to join and we'll get started. Hope everyone is having a nice day. We have a chat window. You can use the chat window to ask any questions. And we also have time in the end. We'll answer those questions at the end. Okay, more have joined. Good morning all. Thank you all for joining. We'll give it 1 more minute before we get started. We'll give it 30. Okay, yeah, it's 2 past the hour. Good morning all. Thank you all for joining. It could be afternoon for some other time zones. So based on where you are, good morning or good afternoon. So we have been covering the HIPAA series of topics in the last few webinar series. So we had covered HIPAA risk management, proactive versus reactive, HIPAA business associate agreements, HIPAA technical safeguards, and today we will cover HIPAA administrative safeguards. We will have a chat window, so you must be seeing a chat window where you can type in, like I'll just say here is the chat, so you can ask any questions here, or you can also you can ask the questions at any point and we will answer at the end of the webinar. Thanks again for joining. So we are from HealthDox. We have experience since 25 years. We had started off with the healthcare GRC solutions on the policy management side, and we have like a suite of solutions. I'll go over it for a bit at the end. We have been endorsed by the Kansas Hospital Association. We had been a member of ASHRAM and HCCA for all these years. We also have been moving on to AI analytical services, and we have an AI package that can assist this governance, risk and compliance solutions. And we also have certified auditors and consultants. So for example, if you want to get ISO 9001 or ISO 30001 certification, right, you can connect with us for more details. So here is our agenda for the administrative safeguards on HIPAA side. We'll go through the OCR enforcement, what are the recent trends today, what are the penalties and lessons learned from the enforcement actions, and administrative safeguards, like what is the foundation of a HIPAA compliance, for example, policies, procedures, workflow training, and how these enforcement actions tie back to weak safeguards, like what about the risk analysis and any training gaps and so on. We will go through the compliance cycle, which is a continuous loop where you have assess, implement, monitor, remediate, and again reassess, right? So we'll go through those, how OCR penalties are often hit whenever these reassessments are skipped. We'll go through technology as an enabler, where the policy management, incident reporting, risk assessments, and dashboards are the tools and how they benefit you, like through audit readiness. They'll help you with faster reporting, and also they reduce your administrative burden. And as I said, we have the AI-assisted features. So whenever you are ready, how the AI automation, which is the next gen of compliance support, helps you in rapidly reducing your manual efforts. And we'll close on the journey, through the journey of the foundation, process, and tools. and how we get to stronger compliance and resilience, and thereby avoiding costly penalties. So here we'll go with the first poll. Let's launch our first poll. And what it is about is how your organization conducts a HIPAA risk. How often does your organization conduct a HIPAA security risk analysis? Please feel free to take part in the poll. Wow, that's good. Most of you have answered as so far 100% is saying annually. That's good. I'm sure almost all of your organizations are doing it. Okay, let's go and close the poll. So you are already aware of this, I guess. So you might be quite familiar with the topic that we are talking about, and you would definitely learn a little more. So how and why this OCR has launched its risk analysis initiative and issued multiple enforcement actions this year is what we can look into. So what is OCR? I'm sure you're aware of it also, but a quick relook on that. So OCR is the Office for Civil Rights Enforcement, which is a branch under the HHS, and it's responsible for enforcing HIPAA regulations. So over the past few years, OCR has ramped up its enforcement efforts. So you must be also aware of this, like it focuses especially on the right of access violations and breach and reporting failures. Reporting failures is a big deal. So if you have come across some situation and then you have not reported it, it is much worse than if not knowing about it. And then lack of risk assessments itself. So penalties are becoming more and more frequent, and it's also expensive. And also it helps with, it actually impacts your brand reputation, right? If you are in a better position taking proactive compliance proactive compliance methods, it will help you with your brand reputation. But once you are attacked and have a breach, then it really damages the brand reputation. So in 2025, there were multiple healthcare organizations that faced very costly HIPAA settlements, and they ranged from like 25K to 800K. And I have a few examples here which documents those. And this is due to inadequate risk analysis, weak access controls, and also insufficient safeguards. So what these cases highlight is the urgent need for stronger risk management. So I'm sure all of these organizations have been doing quite a bit on HIPAA, but that don't seem to be enough because they are heading into the issues. So increased focus on technology-based safeguards for EPHI, higher penalties for weak access controls and missing audit logs. All these have been under the radar. So, right, there's breach detection delays are now a top enforcement trigger. And also OCR is checking into active use of safeguards, right? Not just policy. So earlier it started off with policy management. And then we see more and more organizations are adopting the risk management solutions as well. So also outdated or incomplete security tools are flagged during investigations, because you see the technology world is constantly evolving, especially with AI. The speed has surpassed us, right? So why do administrative safeguards matter to us, right? Most HIPAA breaches don't start with a hacker breaking through the firewalls. They start with the people. I mean the employees themselves, right? The users, the employees. And what we see is that it's due to the gaps in the training. And it could be that you have a policy management system that houses all the policies, but some of the policies may not be clear. And maybe they're not aware of what is happening there in those policies, and weak oversight. So in fact, over 60% of the violations that have been happening are tied to administrative failures. They're not really technology. The technology aspects are tight controlled, but it is the manual intervention that is causing these problems. And why these administrative safeguards are critical is what we will be looking into. Say, because these connect the people the processes and the technology all into one system. So we should not be talking about these as separate entities. So it is like when they're all collectively working together. So with them, without them, right, even the best technical tools can fail. So the people and the processes are very important, and they go beyond IT, right? These safeguards spell out why and who gets access to these electronic PHIs, and then how incidents are reported and what are you doing about these. So you might be filing incidents, but what is happening after that? Are there any corrective actions taken? Is there any root cause analysis being done? Right? And are the patients confident enough to come to your organizations? So all those are important. So we will have the next speaker take on the administrative safeguards.
Thank you, Rita. My apologies, I can't come on cam. I have some challenges there. All right, some of the key administrative safeguards we must be cautious about. Security management process, which is primarily discuss about the different policies and procedures should be in place, which explains different governing mechanism of the HIPAA implementation or HIPAA compliance. And assigned security responsibility, it demands law demands one should be having the responsibility of answering in case of any breaches, in case of any inquiries from the authorities, or in case any kind of a incidents occurred within the organization. One should be having the a secure responsibility where it should be again documented as part of security management. Workforce security, it's all about protecting the workforce environment, their systems, facilities, and all that. Information access management, it's all about how are you granting the access, how are you de-granting the access, what is the change, how are you going to encompass the changes required, what is the provision we have it in the process of the policies, how are we going to change in case any kind of a upgradation is required to the system. All these things are the part of the information access management. Security awareness and training. So what kind of security mechanism, awareness mechanism in place to ensure all the workforce who are having access to the PHI has been made aware about different policies, technologies, systems, and any kind of incidents, at what frequency, what is the content, how are we training them, is it online training or is it kind of a offline training, so what is the frequency, all this should be part of the security awareness training policy. Security incident procedure is all about how are we reporting in case of any incident occurred in our PHI environment. Whom do we report? How do we gather the evidences? Who all should be party in the analysis of the incident? All this should be part of security policy. Contingency plan, one of the most important point is any kind of this risk-based compliances demands business continuity. So again, it's one more expectation is here. We must have to have a contingency plan in case any kind of a disruption occurs to the business. How are we making sure that the patient data or patient rights are not being impacted? Evaluation, it's all about how are you testing the contingency plan. Of course, we have the plan in place, but how confident are we, or how sure we that the plans are working as designed, as required? That's part of the evaluation. And finally, the business associate agreement, it's all about for various reasons in this current business environment, we would be having the vendors or suppliers in the organization context for various reasons. So how are we making sure that the dependent customers or dependent vendors or dependent suppliers are in line with our security principles or policies and procedures? So these are the few high-level safeguards we must be in place. Of course, within that there are sub-controls, sub-recitals are there, but these are the few very, very high-level administrative security rules should be considered while we're doing the HIPAA compliance. All right. So now one of the most important or vital, I would say, the HIPAA compliance is the risk analysis. This is very much required, risk analysis and risk management. How do we do? Method is identifying the risk, analyze, mitigate, and review. So in this case, do not focus only on the IT part of it. We should encompass the risk which also beyond IT. Primary pillar of this risk compliance is nothing but confidentiality, integrity, and availability. So risk should cover all these three pillars of it. So do not think only on the IT risk part of it, think beyond it. There is something from the vendor level or supplier level within the behavior of the people, may be related to something on access or application, infrastructure or network. You should think through beyond IT. That's where the core expectation is here about the security risk analysis part of it. Can we move on? All right. So now from policy to practice. So of course we have the policies in place, well defined policies would be there in place, but how do we make sure that it's being put into practice? So that's where the compliance cycle comes into picture. So for example, here we have policy access to the EPHI only need to know basis. Those who are eligible to get access, only they should get the access to the EPHI environment. Control, what would be the control? Role based in EHR, so we will restrict the roles which is the access to those roles only they can be able to view or edit or transfer the data. Only that kind of control should be implemented. Training, already we have discussed this, workforce education and PHI handling it. Who can disclose the data or who can transfer data or who can edit the data. So these are all the things which are very, very important here as a part of the training to the workforce. Monitoring regular log access, this is very, very key here. It's one of the IT control which enables us to IT operations to make sure that any kind of a unauthorized access is not being gained by external people. So these are the few things on how do we make sure that the policy being practiced. Some of the challenges, policy is not enforced. Like I said in the previous, we had a good policy, everything is well drafted, reviewed, approved, fine. But is it working as designed? Is it implemented properly or enforced properly? So that's where the challenge is. Because of this changing environment, so policy should be having the kind of enforced across the organization wherever they have the access to the PHI. One-time training. So this is very, very critical here. Like I said, various changes would be happening in the environment for various reasons. Just one-time training, maybe annually or 6 months once, it may not be sufficient here. This training should be ongoing basis. Whenever there is a change in the policy, whenever there in the environment, again it should be part of the training. Again, outdated risk analysis. Now, like we saw in the poll, maybe we are doing once in annually, but the people are saying that we have been going through a lot of changes, but risk analysis document they wouldn't have updated it. So because of this, there are maybe kind of a unforeseen risk could be there in the organization, which would it would lead to kind of a breach or anything. Then weak vendor over insights. Like I said, in this environment, we would be having a lot of suppliers in the game of the business. So if we do not have complete visibility onto vendor, what kind of infrastructure, what kind of a security mechanism they have it, which are all the agreement clauses had been covered. So these are all some of the weak vendor oversight, which will lead to the penalties or incidents or any kind of a breach too. So first to HIPAA compliance, how do we do? Update the risk analysis regularly. This is very, very critical here. We must have to go through the complete risk analysis from all the department who are all responsible in handling the EPHI, making sure that risk assessment has been done, risk management has been done properly, and assigned the proper risk owners, being tracked on time. and get to the closure or either mitigation or transfer according to that. Document everything. It so happens that, okay, we have the risk analysis, something is placed. Sometimes we tend to neglect the documentation, which is very, very critical here. Document everything, whatever we have been doing it as a part of the, compliance. Continuous training. This is one more. Various reasons. There will be change in policies, business structure, organizational environment, whatever it is. So the continuous training is the key here to all the stakeholders, all the people who are having access to the PHI. Test contingency plan. So this is very, very critical here. Business continuity is very, very critical in this HIPAA environment. So making sure that whatever the plan we have put in place, it is being tested regularly, and we were making sure that it meets its criteria, maybe in terms of RTO or RPO, whatever the design controls. Strengthen the vendor oversight. So the suppliers should be having the, wherever the control we have put in place to the supplier side, we must make sure that we have the complete visibility of the supplier environment if they are accessing the EPHI or if they are modifying whatever the business requirement is, making sure that we have the complete visibility of vendor environment. Then leverage the technology nowadays being advantage of AI and some more other infrastructure and technology, making sure that we continuously upgrade our infrastructure to make sure that we stay compliant with current technology trends and so on. That's where it's called as reasonable security measures. Then how the technology can support administrative safeguards, policy document and management software. So here it is centralized access to all the policies and procedures with the evidences and so on, making sure that in case of any audit happens, we have all the evidences are handy, available, which can be given to the auditor. Incident reporting tools, again, which is vital here. Any kind of incident should be immediately reported, maybe to the respective leadership or who are responsible within the organization. So we must be having some sort of that tool which will support for reporting of any kind of an incident that is impacting the EPHI. Continuous learning, this is one more very, very important here. So making sure that all are trained on the current policies, systems, technologies, applications, and all that. Again, risk assessment and audits, we must have to have a conduct some sort of a risk audit also to make sure that all the risk has been addressed according to the company policies and procedures. In case of any deviations, they have been notified to the leadership and make necessary adjustment within the environment. And contract or BAA management system, which is business associate agreement management system, which is in turn, in case of any sort of vendor is in place for business reasons, so making sure that he is in line with our contractual obligations. So these are the few important administrative safeguards technology can support you.
Yeah, thank you. So we actually had gone through each of these topics, right? We had one on HIPAA and the importance of BAA agreements and HIPAA risk assessments and how to be proactive versus reactive and so on. And we have those actually in our website if you would like to revisit them or if you haven't seen them earlier. So thank you. So now moving on to a case study again. So let's look at a real world scenario on how it impacts us. So an employee was repeatedly accessing celebrities' patient record, and all of us know it's a big no-no, right? If it is unauthorized access. And because of the weak monitoring system, this event went unnoticed for weeks. So the organization only realized the issue only after the patient complained, which is exactly the type of OCR, type of situations that OCR investigates closely. So what went wrong in this case? First of all, there was a proactive review of the access logs. So everything is recorded, right? It's in the current technology, no trace is left undetected. So there is a trace of every access and by whom, by when, what time, within seconds. And second, the staff wasn't regularly reminded that snooping violates HIPAA, and and that it has consequences, right? That they would be facing consequences. So the third scenario was without a clear incident response plan, the issue wasn't escalated quickly. So that is the worst case scenario, when somebody knows about it and it is not being reported. That is the worst possible scenario. So now here is where the administrative safeguards come into play. Right, they could have changed the outcome. For example, if there was ongoing training, you would have reinforced that the minimum necessary rule is in place, right? Whatever is needed, whatever that EPHI is a big deal is what you would be notified on. And also regular log reviews, you might have to have a dashboard or some system where this information is flagged, and you have some weekly meetings where you review all this, or daily meetings, right? Probably, or an automated alert within seconds of this happening. There are several ways this can be enforced. And also a strong incident response process, right? You should be knowing, like, when there is an incident, how do you record it? Which system records it? And how is somebody notified of this incident? So that based on the priority, immediate action is taken. So with all these safeguards in place, the organization could have detected this scenario, and the problem would have been taken into hands before it was reported, and now it's widely known to the world. So now let's take another poll, a quick poll on what is the biggest barrier you think is in implementing administrative safeguards. So here we go. The poll is launched and you have access. So, like, what safeguards is the toughest you think for your organization to manage? Is it limited resources? Is it lack of policies? Okay, 100% I see is staff awareness and buy-in. So actually, it's a little of everything also, right? I could have given an option for that also. But as you see, no, as you see, if staff is aware, they would be putting the technology issues or boundaries in place. Everything would be taken care of if once you were aware of the system and the process. Thank you. We can go ahead and close the poll. Okay. So the next one is, how do we align these IT controls with organization policies, right? So technology controls are only as effective as the policies they support. So we have the HIPAA safeguards. You can see that there are different technology aspects here. So whether we align them with the policies, or whether it is to access controls, encryption, incident monitoring, several aspects, right? When the alignment is in place, it streamlines the audits, it reduces the compliance gaps, and ensures that the staff actions match both the technical configurations and also the regulatory expectations. So what we should think of is our IT controls as the muscles of the organization, the policies as the skeleton, and both need to be in sync to keep our HIPAA compliance in progress. So let's take the last poll. So all these polls are to ensure that you are always reminded that these review systems, like how often how often does your organization have a review system, and to check these access logs for unusual activity. So the IT team would be aware of it daily or weekly. That's awesome. That's awesome. So you would be catching those issues that the other organization could not. So we are almost close to time. Thanks. Let's close the poll. I think it was like 50% on the daily versus monthly. The last few slides, basically there are different solutions in place, like contract management, HIPAA risk management, audit, and also the AI-powered solutions which are assisting these solutions, right? So we have a all-in-one GRC suite. If you're interested in knowing more, you can connect with us. And there is an AI-assisted package. Right now, this suite that you see is without the AI assist, but we have a pro assist. So what I say is, we have the AI and solution, and we are ready whenever you are, because it takes a while for the organizations to move on to this. So let's take a quick question from the audience. So we have a question here. Nagendra would help with the question and the answer.
Yeah, here I see a question. What is the basis for preparing the contingency plan? Yeah. So here I would say that my experience and the industry standard is that you have to assess the criticality of the each asset, what is there in your PHI environment. What level, what is the criticality of the each asset? Maybe you can rate it from 1 to 3, low, medium, or high, or whatever the rating you want to. You have to assess its criticality, how critical it is for you to run your business in a good environment. You have to assess that criticality. Next, you have to perform business impact analysis, which is in short term, it's called BIA, which will make you or enable you to determine what would be the RTO and RPO for each of these assets. This is very, very critical here. So based on these two things, further you have to refine your plans according to your capacity management and according to BCDR plan and resources, everything you should plan accordingly. So these two are the critical factors for you to define your contingency plan.
Yeah, thank you. So as you know, as you see, we have HIPAA experts in our organization that you can connect with even after. So you have all these methods of contacting us. So you can let us know if you have any questions and reach out. So thank you all for joining. Hopefully we'll see you in the next webinar next month. Take care. Bye-bye. Have a nice week ahead.
Have a good one. Bye.